Once I got to know about Nutramedix, it became the core of my life. I used it on myself, my family, my animals, and I use it on absolutely every single patient that walks into my office. Nobody will leave without one bottle of Nutramedix. If you know how to use Nutramedix, you have to know the combinations. You have to learn specifically each and every product, how to use it, when to use it, how to combine the products. If you know this formulation, it is the most magical product on this earth for me, because the answers lie in every single bottle of this Nutramedix product. Thank you, Tom. You've helped a lot of people. So today, as you can see, we use bioresonance testing in our offices, live blood analysis, spectrophotometry testing for minerals, amino acids, heavy metal poisonings, toxicity, oxidative stresses. Obviously, we need... Sorry, I'm a little bit... Is that okay? Yeah? Okay, yep. Spectrophotometry testings. We use, obviously, we need blood tests, urine, stool analysis, DNA testing of patients. Protocols will always include natural supplementation and non-invasive alternative therapies. So if you join all of these together, you will definitely get your answers for what you're looking for in Nutramedix. For nearly 2 decades, I have been utilizing and developing the Nutramedix protocols in my professional practice. I have observed highly successful outcomes in a lot of cases. Today, though, I'm going to emphasize only on neurological disorders. I'm going to talk about autism spectrum disorders. The reason I chose this is because we have, at this very moment, 6 patients, age groups 1 to 9, and adults from 25 to 30 years old. They're all male patients. All patients have been previously diagnosed with ASD on various levels of spectrum and presented with symptoms of ASD. Somatic symptoms accompanied in ASD patients were different in every case. Throughout the diagnostic process, several common observations were made among all the patients. So all of these patients that we have, they all came up with the same common diagnostic observations: reduced oxygen to the brain, imbalance in the autonomic nervous system, and impaired function of the vagal nerve, impairment of hypoglossal nerve leading to difficulties in speech abilities, adrenal insufficiency affecting mood, behavior, and energy levels, sleep disturbances and insomnia, constipation and digestive disorders, and lastly, the presence of multiple intolerances to major food groups. These findings highlight the multifaceted nature of the conditions observed and underline the significance of addressing these factors when developing treatment strategies. And it's very important that every single case study has to be accompanied by a food program. 99% of what you eat is what you are. So if you don't put the food protocol with Nutramedix, you will not get the results that you're looking for, especially in my cases. Each patient exhibited positive test results indicating presence of heavy metal toxicity, notably aluminium, the highest of all. Mercury was second. Lead, cadmium, and silver were consistently detected among all patients. Significantly, the frequencies associated with ASD. Moreover, we had additional heavy metal poisonings, namely arsenic, beryllium, and bismuth were identified in specific cases. These heavy metals warrant consideration as potential factors when formulating treatment approaches from individuals diagnosed with ASD. And I'm sure you all have got an idea where these heavy metals came from. I won't say. Every patient exhibited positive test results from 2 prominent viruses. Particularly, Epstein-Barr virus was detected in the brain, resulting in the development of encephalitis, while Coxsackie virus was identified in the heart, leading to the sensitivity in and around the ears. So if you make the connection, all autistic children are very sensitive when it comes to their ears. You cannot touch their head. You can't put a hat on them. They become extremely flattered. And what we've realized is that all the patients, due to the nerve endings from the ear, is connected to your heart. So all these patients had exactly the same effect due to the Coxsackie in the heart. Furthermore, additional viruses were detected. A certain case suggests the potential relevance when addressing the treatments again of ASD. As you can see, cytomegalovirus, herpes simplex, mononucleosis. Again, every patient exhibited positive results for a diverse array of bacterial species. Notably, mycoplasma was detected in all the cases, with some patients presenting in the nervous system, whereas in others in the lung region. Moreover, all the patients demonstrated an imbalance in the microbiota composition and exhibited compromised immunity in the colon. Lastly, it is important to note that all patients presented with gastrointestinal issues. Although the pathogens were not consistent across all the patients, there is an importance to identify and address the individual pathogen when conducting treatment protocol to the individuals. Mycoplasma was found in 2 patients, in the nervous system, and the others was in the lung area. Across the patient cohort, an array of fungal organisms was detected, specifically mucormycosis. A fungal infection was observed in the brain, lung, and colon region. Furthermore, the Candida albicans manifested with gastrointestinal tract of all the patients, while Candida parapsilosis was found in all patients in their mouth. This is where we found that it caused a dysfunction of the olfactory nerve, the thyroid, and it was related to that overgrowth of Candida within the mouth area. Additionally, all the patients exhibited a positive presence of penicillium. Because of what? Overdose of antibiotics. Consistent overload of antibiotics. We are the #1 country in the world. It is worth noting that although further fungi were detected among selected patients, these fungal pathogens did not manifest uniformly across all cases. Thus, when addressing the treatment of individuals with ASD, these fungal pathogens should be taken into account, particularly Aspergillus and Tinea crucis. Warrant vigilant considerations. And as we know, Aspergillus is one of the most difficult fungi to get rid of. And thank God we've got Nutramedix. A comprehensive assessment revealed that all patients were afflicted with parasitic infections. Notably, the infestation observed in each case was attributed to Enterobius vermicularis, a prevalent parasite commonly known as pinworm. Amongst all patients, additional parasitic infections were identified, exhibiting distinct parasite types in each case. Consequently, it is important to take into account these specific parasites infections while devising treatment strategies. As you can see, especially sheep fluke, again, very difficult to get rid of, and tapeworms. And there's one specific importance in how you should get rid of tapeworms. We'll get to that soon. Comprehensive analysis revealed that all patients exhibited deficiencies in various essential vitamins and minerals and amino acids. These included zinc, magnesium, silica, B6, 9, DE, as well as a very large amount of amino acids. So important to regulate the amino acids, and this is obviously related to the neurotransmissions of the brain, which is absolutely important for the autonomic nervous system. The presence of deficiencies in all patients is critical. It's a critical factor. However, when working with individuals diagnosed with ASD, it becomes particularly crucial to address these deficiencies as part of the treatment approach. While other deficiencies may be observed in ASD patients, it is noteworthy to mention that these deficiencies were constant across all the patients. So this is why it was a very successful protocol, because we used it on all these children. Treating individuals diagnosed with ASD involves a structured approach consisting of key stages designed to optimize their care and treatment outcomes. Stage 1 begins with supplement protocol aimed at targeting the eradication of viruses and toxicity in the brain, as well as treating sleep issues. Alongside this, attention is given to nutrition, ensuring a balanced diet that supports the unique needs. Additional proactive measures are taken to manage colds and flus, as ASD patients are often more susceptible to these illnesses. Sorry, can I just move this down? Moving into stage 2, the focus remains on supplementation, specifically targeting bacterial pathogens, as well as addressing core challenges associated with ASD, such as communication difficulties, social interactions, and sensory sensitivities. Stage 3 and 4 continues with supplementations to maintain and optimize progress achieved in the earlier stages, whilst all addressing fungal pathogens and parasitic infections. So we took it stage by stage. When it comes to autistic children, you have to work very slowly and very carefully in order for you to get the results that you're actually looking for. Each stage involves introducing additional supplements or removing supplements based on ongoing assessments and individual responses. The final step entails a comprehensive and long-term treatment plan that extends beyond the initial protocol. It emphasizes the importance of sustained care and continual monitoring in these cases, because they are very sensitive. Stage 1. Stage 1 is a 3-month protocol. You can see that to begin, we recommend dosage to be very important in autistic children. Why? Because we want absolutely no hexagon effects. We want no side effects. As you mentioned, if we do have side effects in children, they immediately want to stop the treatment. So what we have found is that we started the drops by 1 drop, and we included 1 drop every day until we got to 10 drops for the kids that were ages 1 to 10. From 10 to 30, we then continued to 15 drops. We remained with these drops for the whole 3-month protocol, and this was 3 times a day. So it'd be morning, lunch, and dinner, and we try to put these at least half an hour before their meals. If not, 15 minutes again works. The treatments that we actually used here: number 1, buberpinella, as you all know, full form of detoxification, but number 1 detoxification for the nervous system, the brain, the spinal cord, and whatever toxicity is in the brain, you use buberpinella. That was my favorite for these children. Takuna, again, the king of viruses. Placing Takuna with buberpinella just gave us a full count of, let's say, positive effects against the viruses. Algas and cilantro put together were put for combating all heavy metal poisoning. Now, at the time, we never had the binder plus. So in those days, if you applied algas and cilantro together, the combination was so potent that we actually found that it also reduced the electromagnetic fields of these children, because all autistic children use iPads. They can sit on their iPads for hours because that's what keeps them motivated. So in that situation, we used both algas and cilantro, but we found algas to have a very strong effect on the kids, because do you know that we have a lot of side effects when you try to remove heavy metal poisoning? So you have to shift everything very, very slowly. If you don't, immediately there will be an effect. We found with algas being such a strong protocol, such a strong tincture, that we started off with 1 drop and we increased it every 3 days for the little children.
Lee told me the algas and still on throw 3 times or 2 times a week, but you dose it every day?
Well, like I said, you start from 1 drop,
Yeah.
and we were increasing. We then saw that we had side effects with our gas. So we thought, no, we're going to go from the beginning again. So we took our gas and we applied it every 3rd day. Salayandra, though, doesn't have that reaction. It didn't have it on my children. So what we did was, applying the 2 together, we would add the Salayandra faster than we would our gas. If we did have any form of reaction, we recommended the mothers to reduce the drops, stay on that drop, whether it's 2 or 3 drops for a couple of days. Once the side effect has gone, then we say to them, move on to the next dosage. The results were phenomenal. And by doing the slow course, we actually, after that, had absolutely no effects on these children. We just had positive results continuously. Azov, moreover, is included as the primary supplement to combat emotional and psychological traumas. I absolutely love Azov. Azov is, for me, the #1 product that actually removes and deletes traumas. We have a program that we can actually measure traumas from the very day of gestation. And it shows us the ages, the months, and so forth, where the trauma exists. We use Azov, and a month later we retest this, and it starts to delete. And it's amazing how this product works. Again, Azov is a very strong product. So on these patients, we had to go slow again. For the little patients, we went again 1 drop, and we increased it every 3 days until we got to 5. Reactions with Azov, we found they could have a little bit of a nightmare. They can have a little bit of an insomnia effect in the beginning. But after 5 days, we found that all the patients de-stressed and started having a much better form of sleep. It combated nightmares, night terrors. We had screams at night. The little kids wouldn't sleep in their own bedroom. They were always in the bedroom of the mother and the father. So with Azov, we started to have this ability to be able to release the mom and the dad and get them to sleep in a different room. Magnesium we found deficient in all the children, and I believe Dr. Besser will tell me this, is that we found that all the kids that had very high aluminium had very low magnesium. Is that correct? Additional supplementations was live cultures, probiotic and a colostrum. You have to find obviously a very good quality one, because all the children had a deficiency of that due to the gastrointestinal disorders. And here we entered stabelium, which is an omega. At the time we didn't have krill oil, and so we were using the omega-3 stabelium, which has the ability to help with cognitions, memory losses, but it releases anti-stress hormones, therefore allowing our patients to be more calm, more active, more concentrative. As previously highlighted, individuals with ASD commonly exhibit multiple food intolerances within major food groups. Therefore, it is paramount to incorporate a comprehensive and personalized nutritional plan as an integral part of the treatment protocol. This tailored approach takes into account the specific dietary needs and intolerances of individuals with ASD, ensuring that the nutritional requirements are met while avoiding trigger foods that may exhibit symptoms. As you can see here, all these foods get tested one by one. So we test about 600 foods on every single patient. And here we found they were all gluten and lactose intolerant. They couldn't eat egg yolk. Dairy products was completely out. Chocolate and refined sugars, red meats, processed meats and fish. Fish that is full of mercury has to be completely avoided. Alcohol, caffeinated products, corn, another GMO product in Europe, which we have to be very careful, affected these children, and also carton juices, carbonated drinks, sparkling water, and artificial sweeteners. The recommendation is always given to all the parents, and we try to keep to obviously fresh organic fruits and vegetables, egg whites, legumes, and pulses. It's absolutely important for them to drink purified water. Water that's not been calcified or has hormones inside of them or chlorine based. Otherwise, just by giving the wrong water, you will have a reaction. Poultry was put in, obviously we advised for organic, and fresh fish. We always advise fish of the season because all other fishes, I think, are contaminated today. Seeds, especially sunflower and lecithin. The carbohydrates would be oats, quinoa, millet, and rice. Oats, as you mentioned, would go for the more organic ones. For fatty acids, we would use olive oil, coconut, and avocado, fresh juices, and herbal teas. As previously mentioned, individuals with the ASDs are more susceptible to contracting colds and flus. Therefore, it is important to include a cold and flu protocol that patients can refer to. The following supplements were recommended. First, Cemento, the king of Nutramedix. Cemento immediately acts on the immunity. It's an anti-inflammatory as well as inhibits congestion. Quina for me is the antibiotic of Nutramedix. It's there for the spasmodic effects that they get during colds and flus, the aches in the muscles, the nerves. Quina is phenomenal for that. Takuna, very, very good for getting rid of the viruses. If we have complicated form of viruses, I would also adjoin Takuna with Tanjarana because they work fantastic together. Noni, excellent for the reducing of fevers. Always have this for children. It's fantastic. It stabilizes the fevers, but at the same time, for me, it's the number one product helping for gastrointestinal flus. And vitamin C. I have used maybe 35 types of vitamin C, but I have never seen the reaction of vitamin C such as Nutramedix. And because we have machinery that we test, I always see that with Nutramedix, vitamin C goes up immensely and quite fast. Results from the stage 1. You can see straight away, I advise conducting a reassessment after 1 month of implementing the treatment protocol to evaluate its effectiveness. If no issues arise, the protocol should be continued as prescribed for remainder of stage 1. The results that were observed after 1 month only: decreased hyperactivity and improved concentration levels, enhanced sleep quality, noticeable improvement observed from the first week. The one patient did not sleep for 9 months. And I will say this child, his name is Raul, he was fine up until the age of 3 months. The day he received the MMR vaccine was the very first day that their whole life changed. By the evening, he had 40 degrees temperature, and by the next morning, this child was screaming in fits. He did not sleep for 9 months. They went everywhere. Nobody could help them. And once they came to us, from the very first week, the mother said to me that these Nutramedix product worked, that this child slept after 9 months. And as we know, with all autistic children, they have a 15-minute sleep pattern. They sleep for 15 minutes and wake up again. They can have an hour, 15 minutes back into sleep, and then they're awake again. So by using Nutramedix, which is a very subtle, very safe product on children, it seemed to have calmed them and brought them into a good rhythm of sleep. Alleviation of constipation and restoration of regular bowel movements. They all had an increase of appetite and healthy weight gain, so they started including different foods. Improved coordination abilities, progression in play skills, heightened verbal communication and responsiveness, increased tolerance to physical touch. These positive outcomes indicate the efficacy of the implemented treatment protocol and reinforce the importance of personalized interventions in the ASD patients. Stage 2, again, 3-month protocol. everything, whatever you remove and whatever you re-enter, we start again from 1 drop, so we don't have any form of reactions. So in stage 2, Verbipinella, algas, cilantro, magnesium remain the same. During this stage, I would advise removing tacuna if we've had a clearance of viruses. If not, you would continue. And we would also remove Azov, as we have seen that the trauma subsided, all the children started to sleep. On stage 2, the following additions were included. We included Mapalo. This indicated an anti-inflammatory supplement which helps to eliminate brain fog and confusion. But I found something very important about Mapalo, which I don't know if you know about. Mapalo also helps the detoxification process of dead cell necrosis and helps dislodge clogged relay congested blood vessels, in turn stimulating and regenerating new brain cells. Amazing. And obviously the reason why we put Mapalo on the second stage is because once you have a clearance of toxins in the brain, you then go forward into treating the dysfunctions of the brain. The other factors that we found with Mapalo is that it rebalanced the central nervous system, the autonomic nervous system, the vagus nerve, and it also balanced the governing and the conception vessel. Secondly, Amantilla replaces Azov during this stage, and it is included to help eliminate stress and anxiety, to help stabilize the moods, and most importantly, Amantilla appears to be primary supplement to combat panic attacks. So we had a few cases where we had panic attacks with these children, and in order to subside this, we directed the patients, the parents, to put Amantilla directly under their tongue every 15 minutes. It takes about 4 to 5 dosing, and immediately we had a suppression of the panic attack, which was amazing, and absolutely no form of side effects. We then included Kumanda. Kumanda for me is the #1 product for constipation in children. It helps with the elimination of food stagnation. It helps treating and helping colon peristalsis. And at the same time, it's a brilliant evacuation formula. So remember, Kumanda. And if you don't have correct evacuation for these children, you will have a second form of toxicity. Lastly, Noni is included during this stage to decrease gastrointestinal issues, as well as acute and chronic food poisoning. So any form of food poisonings related to these children, we always use Noni. Additional supplementations, IRF cultures, stabulum stays the same, and obviously you all have to test and everything related to the vitamins, minerals, and amino acids. So whatever is rebalanced, we remove. Whatever's deficient, you have to replace. Stage 2 of the protocol. This is after 6 months of treatment. Improved quality of sleep and regulation, sleep cycles. Here, establishments of regular eating patterns in ensuring sufficient nutrient intake. Regulation of bowel movements indicating improved digestive function. Significant reduction in hyperactivity with a pronounced decrease in frequency and intensity of hyperactive behavior. Further increase in concentration levels, leading to enhanced focus and attention.
Okay.
These pictures are from patients, by the way, from their children. We had an excessive amount of elimination of parasites, implying a positive response to the treatment protocol. These outcomes demonstrate the efficacy of the comprehensive treatment approach is implemented in stage 2. And immediately after the evacuation of these, and I've got so many pictures of parasites to show you that parents were getting such frights, because I was saying to them, look at the stools, make sure you see what comes out of these children, we need to know. And they thought, does this really exist? And they started sending me pictures. If you see my phone, it's full. My daughter says, Mom, don't put any more because I'm going to freak everybody out. But after these worms were released, they had such an improvement of sleep, the behavior, cognitions, and overall well-being highlighted positive impact of the combined therapies and interventions. Oops, let's go. Oh, how do I can? Third stage protocol, as you can see here, during stage 3 of the protocol, the following supplements remain the same: verbapinella, algas, cilantro mapala, and magnesium malate. In accordance with the feedback from the patients, amantilla remains during the stage, only to be used as a sleep issue and a mood changes arise. We said to remove, but apparently all the patients said, no, I need to keep this just in case. And they do use it when it's necessary. Kumanda, the same. I found with all the patients, their mother said to me, please can I have Kumanda? Because you don't want to use a laxative on a child. So they all have Kumanda at home, and magnesium stayed the same. On the third protocol, we put in Sparga. Sparga included as the primary supplement for eradicating all forms of fungi, especially Candida and Aspergillus. I found this to be an excellent product. And even Tinea cutis, which is on the nails, Spargo is the #1 product, especially if you use it with photon therapy. We have found to actually remove fungi of nails which have been there for approximately 20 years. And this was done with Sparga. Drinking Sparga, but applying Sparga actually on the nail and massaging it with photon therapy. Try it. It's phenomenal. Zinc at this stage, we had to put in zinc because they had zinc levels were not stabilized, so we put this in for immunity to help with healthy thyroid function, and most importantly here was to promote normal growth and development. Again, the IRFs cultures would remain the same, stabilium the same. Again, reassess your patients and see what is necessary. Whatever isn't necessary, you take out. Whatever is, you will apply. The stages 3, the breakdown of the protocol. Specific guidelines are followed for the consumption of all supplements over a 3-month period. In the first month, it is advised to consume all drops 3 times a day before meals. Moving into the second month, dosages of drops remain unchanged. However, in the third month, the consumption of drops is reduced to 2 times a day, once in the morning and once in the evening before meals. It is important to note that both magnesium malate and zinc remain the same throughout the stage. Results from stage 3. After the 9 months of treatment, conditions showed significant progress and positive outcomes for individuals. Here we had increased eye contact. That for me was the #1 factor. As soon as you get eye contact with these children, you can light up because you know that the functionality of the brain and the neurotransmissions have actually started. Indicated improved social engagement and communication skills, further decrease in erratic and hyperactive behavior, demonstrating enhanced self-regulation and impulse control, successful integration of some patients into normal school environments such as nursery settings, suggesting improved social and academic functioning, participations of 1 patient in a boccia team highlighting increased social participation and engagement on organized activities, development of play skills and engagement in games such as puzzles and mind games indicating cognitive progress and improved interactive abilities, continued improvement in emotional regulation, emotional stability, suggesting enhanced emotional well-being and self-management. These outcomes signify the ongoing effectiveness of the treatment protocol implemented during stage 3. The improvement in social interactions, behavior, cognitive skills, and emotional regulations demonstrated the positive impact of the comprehensive interventions provided. Stage 4, anything between 6 to 12 months. This alters in all cases. Here we remained with verbapinella, algas, and magnesium malate, as these components are deemed essential for continued progress. In the event the zinc level have stabilized during the stage, it is advised to discontinue the use of zinc. However, if zinc levels have not yet reached a stable stage, it is recommended for patients to continue including zinc as part of the protocol. I have found though with Nutramedix zinc, because again I've used so many zincs, within 1 or 2 months we had the values that were necessary. So as we know, zinc goes for 2 months, and for us it was appropriate. Again, with any new product that comes in, you start off with 1 drop and you increase daily. In stage 4, we introduced Hutinia and Andrinol. Hutinia plays a crucial role in addressing digestive issues, including inflammation, bloating, and excessive gas accumulation. Its significance lies in the ability to combat various forms of parasitic infestations, such as tapeworms, flukes, and a lot of intestinal worms. I found that Hutinia to be the number 1 in this specific case. It also offers cognitive support and aids in the treatment of cognitive impairment, contributing to improved cognitive and memory functioning. With the Andrinol in stage 4, this is to restore normal adrenal function by rebalancing the pituitary gland, the thyroid gland, as well as regulating the testosterone and the androgen levels. So in the older kids, we had an excessive amount of these hormones, which we had to re-regulate. And so Andrinol, you must know, is excellent for reducing testosterone and androgen levels, but not just in these children. Even in women that have excess testosterone and androgen, Andrinol is my number 1 product for doing that. It also stimulates the adaptogenic effects of adrenal glands, which help to rebalance the cortisol level. In turn, this can lead to a reduction of symptoms of low mood, irritability, and anxiety. It is noteworthy to mention that the regulation of testosterone and androgen, as we said, were in only the particular ages after 8. Additional supplementations, again, the probiotic would remain throughout this protocol, as they all had a very low form of immunity in the colon. Stabilium will remain, and again, you would choose your extras. Stage 4. In the first month, it is advised to consume all the drops, again, 3 times a day, except for Andrinol. It is crucial to refrain from consuming Andrinol in the evening. We found that Andrinol for all the children caused a subsequent sleep disturbance. So we decided to remove Andrinol in the evening, and we only applied it in the morning and before lunch, which was enough. As you can see with the picture, the reason why I put this picture there, as you can all see, what do you think this is?
No picture.
There's no picture. Oh, and the others? Did it show the pictures of the other worms?
Yeah, it's all the other worms.
Oh, how can I show this picture? Oh,
There's some. Yeah.
okay. Here is the picture. This was sent to me by one of my patients. So this was a tapeworm.
Small one.
Okay, so as you all know, how do tapeworms come out of the system when you detoxify them? Does anybody know? They always come out in segments. Always. In this specific case, all our children remove their tapeworms whole. Do you know what that means? That the variability of using the Nutramedix compound is that it's so gentle that it doesn't attack the actual parasite in a way where it slaughters it, is what we found. It actually accumulates, bonds it, and removes it. So in so many of my cases, the tapeworms drop out in one form. And for me, that was phenomenal, because I know for a fact that it's impossible to get this result. And we started to find this once I started using Nutramedix. That is so important. Why? Because when you attack a parasite, it will attack you back. You will have excessive side effects. Whereas the gentleness of Nutramedix doesn't allow that. Did you know that, Tim? Yes. This is how special this product is. You have to treat the product, the patient, with care. And whatever you do, even if it's a parasite, if it's a worm, if it's a fluke, if it's a bacteria, they are living matter. To get rid of living matter in a body, you do not irritate them. Otherwise, they will irritate you back 10 times more. So the suppleness of Nutramedix is what allows us to have this gentle form of evacuation, which is what I found to be amazing. Okay, so results from stage 4. After 12 to 18 months of treatment, it demonstrates significant achievements and continued progress in individuals with ASD. Transition to eating solid foods in 2 cases, indicating improved oral motor skills and expanded dietary varieties. Increased in confidence and social interactions, suggesting enhanced self-esteem and improved social engagement. Enhancements of language and lexical development, with variations observed based on the age and the placement of each patient on the autistic spectrum. Increase in verbal communication, with the extent of communication progress varying for each patient based on its age and the placement. Evacuation of tapeworms, indicating successful treatment of parasitic infestations. These outcomes exemplify the effectiveness of the comprehensive treatment protocol implemented during stage 4. The advancement in feeding skills, language development, social interactions, and parasitic elimination highlighted the significant improvement achieved over the course of 12 to 18 months. The individual nature of the progress, considering age and placement on the autism spectrum, underscores the importance of tailored interventions to address the unique needs of each individual ASD patient, specifically regarding speech and occupational therapy. What did I do? Okay. I would like to present to you, can you see the pictures? Mm-hmm. Okay. A collection of pictures and videos that showcase the diverse stages of treatment progress. I want to emphasize that I have obtained permission from these parents. And here we have Mario. He came in a wheelchair, very depressed patient. He cried all day. He couldn't sleep. He needed to go for drives in cars for hours and hours. It was a living nightmare for his mother.
What is that?
Here we have David.
Black. Pink. What is pink? Wait.
This was actually after 1 hour. It took us 1 hour to actually get to test this baby. Okay, next. No. Here we see in the second stage that Mario has lost weight. He's starting to become a little bit more active. He started to speak. He started to be more confident. And here with David.
Yes. Yeah, you say yes.
That's our David. And again, second stage, he's wearing a hat. He would never wear a hat. If you dare to touch his ears, he would scream for hours. I'd have to send them home, bring them back again. So we had to find a way not to cause any form of disorderly activity.
Of the length of Mr. Tall's legs, they There he quickly walked all the way to seaside. Come for a swim.
Okay, so this is obviously going into the treatment. He's 4 years old over here. He started to speak 3 languages, tallest in his class. Actually, he was the most cleverest in his class by that time. His coordination skills were phenomenal. Look at this. This is an autistic baby. And this is our Marios. As you can see, he entered in the Bocce Games Cyprus team. He started to become more confident. He started speaking. He actually would say to his mom, please take me to the center. I need to go see the girls. And he would come to the center just to get energy. But obviously we did protocol treatments on him. We prepared him for the coordination of throwing the ball. So this was the importance. So if you can see here with Marios, how difficult it is to actually throw the ball. We take it so much into advantage, the things we can do. And when you see these children who can't do these things, you can understand the happiness of the parents as well as us doctors seeing these results in these patients. It's just, for me, everything. There we go. That's Mario. Okay. The nutritional program continues to be an essential component of the treatment protocol for individuals with ASD. You must know that 99% of this protocol cannot be done without the food. The program is tailored to meet the specific dietary needs of each patient and is maintained throughout the treatment duration. Additional therapies throughout the whole protocol, such as speech therapy, occupational therapy, equine therapy, aquatic therapy, and multiphoton therapy are continued for as long as necessary. The frequency of sessions may be adjusted based on individual progress and requirements. In cases where patients experience sleep disorders and disturbances, supplementations such as Amantilla, Azov, and Babuna would be applied. If patients still experience any form of constipation, bowel disorders, or activities, we would keep the Commander very safe, very easy to use. In the event that the patients became sick with a cold or flu, a specific cold and flu protocol is applied to support and alleviate the symptoms during the illness. These additional measures are implemented as needed, considering the individual needs and response of each patient throughout the treatment process. The goal is to provide comprehensive support and address specific challenges of health issues that may arise, ensuring overall well-being and progress for each individual. The treatment protocol for ASD can extend from 2 to 5 years, acknowledging the individualized nature of progress and the unique needs of each patient. Following the initial start of the protocol, a 1-month reassessment is advised to evaluate its effectiveness. During the first key stage of the treatment protocol, regular reassessments every 3 to 4 months are recommended. Based on the analysis results, supplements may be removed, included, or replaced to optimize the treatment plan and address specific needs. Once the key stage of the protocols are completed, reassessments can occur at intervals ranging from 2 to 6 months, depending on the individual patient's progress and requirements. Certain supplements such as Burbapinella, Algas, Mapalo, and magnesium malate are recommended to be continued after the completion of the key stages. Additional key supplements that are suggested to be maintained after the completion of the stage is the live probiotics, colostrums, and stabilium. These supplements are considered important for ongoing support and maintenance of the achieved progress. The ongoing reassessment adjustments of supplements and the inclusion of specific key supplements aim to ensure the effectiveness of the treatment protocol. And here is our final results. Here you can see Mario. Want to cry? He's off his wheelchair. We finally got him to start walking with the help of his aid here. He lost weight. He became extremely confident. He started speaking again. I don't know, all of a sudden his tongue opened. And because my whole team is women, so men love us. They will do everything we tell them. So this is why he would continuously come for treatments. All the treatments were for free for him. So I think this adjoining of love and care and affection to these children is the utmost importance. With David, as you can see here,
Τροκάραβο. Κοντά στην Κέρκυρα υπάρχει ένα μικρό νησάκι που μοιάζει με καράβι. Λένε ότι κάποτε στα παλιά χρόνια φάνηκε από μακριά ένα παράξενο καράβι. Όλος ο κόσμος βγήκε στην ακρογιά για να το δει.
so David, he's off the autistic spectrum listing. He's number 1 in his class. He speaks 4 languages to this day. Interactions are amazing. Unless he's scared of you, he will stand aside. His activity is very normal unless he gets a little bit excited. You'll see the flapping, so you'll understand he is an autistic child. But I can tell you that 90% of his symptoms have been alleviated. I want to thank you all for listening to me. I hope this was interesting.